Hello students, today we'll be continuing with the chapter Reproductive Health and this is your second session. So today we'll be finishing your first unit. So in previous class you have studied about the problems and strategies and the population explosion and birth control and family planning method. What are the contraceptive methods? So the contraceptive methods, natural method, barrier method, intrauterine devices, oral contraception, and the permanent methods you have studied. So today let us study about medical termination of pregnancy, that is MTP, and sexually transmitted diseases and assisted reproductive technologies, that is ART. In mid-1970s, Leslie and John Brown, this was a Bristol-based couple, they didn't have children after 9 years of marriage. So they visited many doctors and finally they met a doctor called Dr. Patrick Steffi and Dr. Robert Edwards. So they thought they will do an experiment so that they could get a child. So Dr. Steptoe, he extracted an egg from Leslie, from that lady. So the egg was then mixed with the John's sperm, her husband, for fertilization. So both husband and wife. And this fertilized egg was then placed in a solution and was allowed to divide into 64 cells. The fertilized egg developed into embryo and this was placed into Leslie's uterus. 9 months later, so on July 25th, 1978, Leslie delivered Louis Brown. They got a child. It was the world's first test tube baby. So this Louis' birth was considered as a medical victory and it provided hope to many infertile couples. So the couples who were unable to conceive or produce children after 2 years or unprotected because of sexual cohabitation. So infertility can be caused by many factors including physical and congenital reasons, sexually transmitted diseases, drugs, immunological or even psychological or also lifestyle. Because of that infertility may cause. So to treat infertility, couples are often advised to visit infertility clinics where the doctors evaluate both the partners and they check the reasons for the infertility. So based on the results, the doctors they will suggest some medications or surgery. Or for instance, if a blocked fallopian tube is preventing the woman from conceiving, the doctor will suggest surgery to unblock that. So however, when surgeries or medications they fail, doctors they might suggest for assisted reproductive technologies or ART. So ART is a collective term used for clinical procedures that are designed to help to achieve pregnancy by allowing the egg and sperm to meet in an artificial environment, usually a laboratory. So today there are several types of ART available for infertile couples, including in vitro fertilization, intrauterine transfer, zygote intrafallopian transfer, gamete intrafallopian transfer, intracytoplasmic sperm injection, and artificial insemination. So in vitro fertilization or IVF, which was used to treat Leslie Brown. This is a process in which egg is fertilized by the sperm outside the woman's body under stimulated conditions which are created in the laboratory. So IVF is also called as a test tube baby program. Interestingly, the gametes can be collected from the partner or a donor. Once the egg and sperm are collected, they are placed in a dish for fertilization and incubated together to form an embryo. So this is embryo. The cells are dividing. Now, IVF is followed by embryo transfer or ET, where the embryo is transferred to the uterus using tube called a catheter. Apart from IVF, couples can also opt for intrauterine transfer or IUD. In this method, embryos formed by the fusion of gametes inside a healthy woman's body or in vivo fertilization. They are removed to surgery and then transferred into the uterus of the woman who wishes to conceive. And another option available for infertile couples is the zygote intrafallopian transfer or ZIFT. In this process, similar to IVF, where the gametes are collected and the egg is fertilized in the lab. Post-fertilization, when the zygote contains more than 8 blastomeres, the doctors create a small incision in the abdomen using a fiber-thin tube called a laparoscope. So you can observe that the zygotes are then transferred to the fallopian tube through the laparoscope. So here a laparoscope is also used in the another article called the gamete intrafallopian transfer or GIFT, in which a healthy egg from a donor is placed inside the fallopian tube of a woman who wishes to conceive. GIFT is performed when the female partner has non-functioning ovary, but her uterus and fallopian tubes are in a healthy condition and they are capable of providing conducive environment for the fertilization and fetal development. So at times women may not able to conceive because of the male infertility resulting from low sperm count, low sperm motility or damaged or missing vas difference or inability to inseminate. So in such cases what happens? The couple can opt for intracytoplasmic sperm injection or ICSI, in which the doctor injects a single sperm into each ovum, which leads to fertilization. Post fertilization, the fertilized egg divides to form an embryo, which is planted inside the uterus using catheter. You can observe that there. Apart from this ICSI, artificial insemination is another option in which semen is collected from either the male partner or a donor, and it is introduced into the vagina or uterus by inserting the catheter. So artificial insemination is also called intrauterine insemination or IUI. Artificial insemination as well as ARTS are helping infertile couples realize their dream of becoming parents. So however, one should remember these methods, they are expensive and they will require highly qualified doctors as well as expensive instruments. And pregnancy is the most wonderful experience for a woman, right? If one gets pregnant as a result of rape or unprotected coitus or failure of contraceptives used during coitus, could be turned out to a harrowing or distressing experience. So under such circumstance, what does this women do? They'll go for medical termination of pregnancy, or MTP. It's nothing but the abortion. So MTP is the intentional voluntary termination of pregnancy before full term. What will they? They'll take out that fetus before it gets developed. So if doctors will suggest MTP only if the woman is having some severe conditions like blood pressure or heart problem. So during that case they will ask to take MTP. And my MTP is also advised if there is child possibility, if a child has physical or mental disability. So nearly 40 to 50 million women will opt for MTP every year. In this, for in India it is 6.7 million every year. So when India was independent, these laws of concerning abortion were restrictive, and the abortion was permitted only if the continuation of pregnancy could prove fatal for women, for death for women. So later it started changing during 50s and 60s when demographers raised concerns about India's spiraling population. Means population was increasing. So they were asking for liberalization of this, means it has to be reduced because to lower the birth rate. So because of this, they are asking support from doctors and all. And to address the situation, the Indian government formed the Shantilal Shah Committee in 1965. On the recommendation of this committee, the Indian government passed the Medical Termination of Pregnancy Act in 1971 that paved the way for the liberalized abortion laws. So the MTP Act states that an abortion can be carried out only by an approved doctor. So moreover, while the opinion of one qualified doctor is sufficient for pregnancies of up to 12 weeks. For pregnancies of more than 12 weeks but less than 20 weeks. The certification of two approved doctors is essential to conduct an abortion. This is because an abortion up to 12 weeks of pregnancy is far less risky than one can carry out of pregnancy of more than 12 weeks. However, abortions of pregnancy beyond 20 weeks are prohibited under the MTP Act unless the pregnancy poses a threat to the mother's life. MTP Act has made it easier for women to opt for medical termination of pregnancy. However, experts claim that illegal abortions, including sex selective abortions and abortions after 20 weeks of pregnancy, are on the rise. To reverse this trend, people have been educated about the gender equality as well as health hazards associated with illegal abortions. They are also been educated how to avoid pregnancies by using contraceptives such as condoms and pillow. Condoms, they also can protect young people from the reproductive diseases and infections such as gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and HIV. They are collectively known as sexually transmitted diseases or STDs or venereal diseases or reproductive tract infections. These diseases are contracted through sexual contact. So certain diseases such as hepatitis B and HIV can also be transmitted by sharing injection needles and surgical instruments used by infected persons, and blood transfusion or from the infected mother to the fetus. Different STDs are caused by different pathogens. Chlamydiasis and gonorrhea, they are caused by the bacterial infections. Trichomonasis is caused by microscopic one cell, that is the protozoan called Trichomonas vaginalis. Whereas HIV, the most dangerous of all STDs, is caused by the human immunodeficiency virus. In most cases, people suffering from STDs show symptoms such as itching, fluids discharge, swellings in the genital region, as well as pain during sexual intercourse. However, the symptoms aren't same always. Obviously, in fact, most people don't show any in terms of infection during the early stages of the diseases. So, moreover, when symptoms become obvious, people avoid seeking medical opinion for fear of being stigmatized. People should not forget that the timely detection and the appropriate treatment, they can make a person completely free from the sexually transmitted diseases. There are few exceptions like hepatitis B, genital herpes, and HIV infections that cannot be cured. So, the timely detection is the key to prevent this sexual transmitted disease related complications such as pelvic inflammatory diseases, abortions, stillbirths, infertility, or even cancer of the reproductive tract. You know that sexual transmitted diseases which are widely prevalent in people who are aged between 15 and 24, and this can be prevented if one takes simple precautions such as using condoms and avoiding sex with unknown or multiple partners. Actually, we are responsible for our health, and the simple things such as use of condoms can keep the sexual transmitted diseases away. So much care should be taken. I hope you have understood this chapter, children. So here expansion is very important. Expand MTP, GIFT, ZIFT, IVF, ET, ICSI, STD. Second question, what are sexual transmitted diseases? Give examples. Third one, write any 5 possible methods of transmission and prevention of sexually transmitted diseases. Thank you.